Hello, saya Sasha Saidin dan selamat datang ke Hello Sihat, Apa Khabar, di mana kami ingin bicara bersama anda hati ke hati.
Dan saya Dr Fariza, pakar perubatan hematologi dan pensyarah perubatan serta hos podcast pada hari ini.
Baiklah, ada berbagai cara seseorang akan cuba praktikkan.
Yes.
Nervous sikit sebab hari ni ada guest dia macam...
Guest yang sangat,
Okay. So, cuba praktikkan agar terlihat cantik. Semenjak dulu, nilai persepsi kecantikan adalah tinggi di kalangan masyarakat, terutamanya kaum wanita, di mana ramai wanita terus mencari pelbagai cara untuk kelihatan cantik di depan semua orang.
Betul.
I think we're all guilty of that, no?
Yes.
Jadi, namun, kecantikan sering didebat. Okay? Bukan hanya berasal dari tampilan fizikal, tapi juga dari fikiran yang positif dan pola hidup yang sihat.
Jadi untuk bincangkan topik cantik ni, sebenarnya ada banyak perspektif. Dari segi perubatan, kita tengok kadar metabolisme, body mass index, berat badan, tapi dari segi aspek yang lagi satu pula, perspektif lagi satu, media sosial banyak bagi imej cantik itu berdasarkan takrifan media sosial. Jadi wanita sekarang tertekan Syah. Nak cantik tu
Especially with social
kan.
media sebenarnya,
Jadi
kan?
pada hari ini kita amat bertuah. Saya sendiri tak sabar nak menimba ilmu dengan seorang tetamu yang sangat cantik dan sangat berpengetahuan luas dan
Intellectual.
very intellectual dan memang membawa aura yang positif ya. Bila kita jumpa kat luar tadi pun dah macam-macam ilmu dia dah share. Jadi pada hari ini seorang personaliti yang amat disegani dalam bidang penyiaran tanah air, dalam industri TV, RTM, TV3, seorang penulis buku dan perunding imej terkemuka Dr Sharifah Shawati, binti Syed Mohd.
Dan bukan saja cantik, baik hati, tak kedekut ilmu. Tapi tak cukup dengan itu tau. Beliau telah meraih gelaran Dr Falsafah. Wow. Di dalam jurusan pentadbiran perniagaan iaitu Doctor of Business Administration, DBA daripada European American University. Jadi kami ingin dekati dan kupas dengan lebih dalam tentang kepentingan projection image seseorang dalam masyarakat dan langkah-langkah yang perlu diambil supaya image sentiasa kelihatan relevan.
Betul tu.
Pertama sekali, apa khabar Dr Shawati?
Khabar baik, terima kasih.
Nervous ni.
Thank you Sasha and thank you Doctor. Of course, hari ini kita sama-sama belajar lah dengan aspek-aspek yang perlu kita terapkan ni sama-sama. Saya pun nak belajar daripada Dr Fariza juga. Sasha pun sama, your experience as well as a celebrity. Ya.
Betul.
So, thank you very much. Hello Sihat, apa khabar?
Thank you so much for coming.
It's a pleasure to be here.
Alhamdulillah.
Ke podcast macam ni sebab kita sama-sama women empowerment.
Betul.
Oh, that's so good.
We hope so. We hope so.
Yes.
I believe so.
Kita nak empower
Yes.
semua wanita-wanita kat luar tu kan.
Betul.
Bukan apa, saya rasa ramai juga wanita-wanita di luar tu memang semuanya cantik-cantik.
Betul.
Semuanya pandai-pandai, semuanya intellectual dan sebagainya. Tapi kadang-kadang kita buat sesuatu yang merugikan diri sendiri. Kan? Macam tadi doktor ada sebut tentang tekanan ya. Kadang-kadang tekanan tu kita cari sendiri.
Alamak. Self-inflicted problem.
The problem sebab apa? Sebab kurang research, kurang research dan terikut-ikut dengan social media yang telah memaparkan sesuatu yang indah itu dan cantik itu hanya yang kurus sahaja.
Betul.
Sebenarnya tak.
Betul.
Sebenarnya tak. Ya. Kita punya aim kita ni kan bukan nak kurus, tapi
Betul.
nak sihat.
Betul.
Betul tak?
Okay, you really hit the nail in the coffin. So to speak. Jadi, I'll go straight to my first question because it's related to that. Sebenarnya what you just said, because for our YouTubers and those listening to us on Spotify, mungkin ada yang tak tahu saya duduk di Dubai, saya menetap di Dubai sekarang dan saya notice ada trend sekarang kat Dubai, terdapat pelbagai langkah-langkah yang boleh diambil untuk mengikuti standard kecantikan di Malaysia dan juga di Dubai. I notice similar. Tapi yang satu benda yang saya notice dekat Dubai ada lunchtime treatment. Jadi suami saya dia bekerja di bahagian, how would I say, business district lah in Dubai. So it's very busy kat situ. It's all corporate suites and offices there. And I noticed lunchtime treatment ni. So lunchtime treatment ni sedang hangat diperkatakan seperti dia terapi vitamin IV drip.
Dia buat kat mana tu?
So what they do is sebenarnya dia during their lunch break, waktu tengah hari, lunchtime, dia akan datang untuk buat IV drip ni, and then they just go back to the office thereabouts, and as if like something normal, right?
Macam like a routine.
So far I haven't seen it here, tapi I've seen it in Dubai. Jadi my question is, mungkin because they have a really busy lifestyle there, and then jadual diorang padat, so that's the only time maybe they can do it, you know. So ia dikatakan dapat meremajakan. Meremajakan dan mencantikkan badan dari dalam ke luar dengan terapi titisan IV ni. It's supposed to be tidak invasive. Nanti kita tanya pendapat doktor juga. Actually, we have 2 doctors here. We medical doctor. Jadi, tu. Jadi,
Philosophical.
terapi.
Philosophy.
Jadi, terapi. Medical doctor. Medical questions, push to Fariza. Jadi, terapi titisan IV ni secara tidak invasif dilakukan dalam waktu sihat. Singkat, in just that 1 hour or so. So, adakah in your opinion, or how do you see it, is this norma baru untuk kita semua?
It's not normal baru actually. It has been done for the longest time dekat US, dekat negara-negara Eropah, because they treat this as in like a treat for them. Sebab apa? Tak ada masa, macam you said like that. And then also it's something that is not big deal for them. It's not a big deal. Because to me, kalau IV drip tu, sebenarnya kalau kita kurang sihat, kurang garam, that's why you need IV drip. And then there are other drips as well. So it depends on what kind of drips that you take, kan. Tapi ini kita serahkan pada Dr Fariza.
Tapi in your opinion, for kalau demi kecantikan,
demi kecantikan, I would go for it too. Tapi not lunchtime lah. Saya memang tak ada masa lunchtime nak pergi. I'm sorry, I have to go for IV drip.
Kan? Please excuse me, I have my IV drip appointment.
But I will make time. I will make time. But recently, I just had an IV drip. I just had an IV drip just because I was having diarrhea. Salah makan. Salah makan, and then I feel like macam very lethargic, macam dehydrated sebab kurang air, sebab banyak dah hilang air. So you must know what your body need. So only this kind of thing, I akan go for IV drip. And last time, I used to do IV drip for vitamin C. It's a drip, but it's a vitamin C drip. Because you need to get well fast. So I had my training 2 days before that. So I kata I need to get well fast because it doesn't look as if I was going to get well. So, and I have a job to do. So I bought vitamin C. So, and I felt energized. And it's not really dangerous. So kalau tidak memudaratkan kita dan kita ada capacity untuk buat, boleh je I rasa. Do whatever that you need, but not what you want. What your body needs.
What you need, not what you want.
You want everything. You want to do this, you want to do that, you want to do botox, you want to do everything. But is it what you need? Orang kata, kenapa you nak buat? You dah cantik, you dah ni. Tapi only you will know why you want to do it. Why? Kan? Sometimes people do like lips yang besar sikit, yang kecil sikit. Why? Ketika kita tengok dia, cantik lah. Tapi dia mungkin deeper level that is actually haunting her from inside.
True.
Dia rasa macam dia tak lawa. Dia rasa macam bibir dia kecil. Dia tengok orang lain buat bibir macam munggil, kan. But it looks good on them. But when you do it, it looks terrible on you. So, but how can you advise this kind of person?
Do you think it might come from insecurity or something they face?
Lack of confidence. Insecurity, definitely. And also, when you dig deeper into the fact that why they do it, it's always about trying to please others rather than themselves.
Setuju.
Padahal, they feel okay. But because people say, oh, you should do this, you should do this. People can say a lot of things. Oh, you should do this lah, this way, this way. You should do this lah. Tapi yang bayarnya kita. Yang merasanya kita. You know, but after we do it, we feel like, I should have done
Sebab bila
this.
kita buat benda-benda tu, kita nak orang tengok,
Nak orang tengok
Betul.
nak orang cakap, nak orang
Betul.
komen.
Orang puji.
together with the trend. Want to be part of that glamorous world.
Yeah.
It goes back to the question yang Sasha cakap, nak cantik tu kan. So,
Yeah.
you nak cantik untuk siapa?
Untuk siapa?
Untuk siapa?
Is it for
Yeah.
you? Or is it making you feel fulfilled? Then you do it. But if it's for somebody else, let's say if you do it for your husband, for that matter, yeah? Okay, this is another...
Another topic.
You want to please your husband. Your husband never complain. But you feel that as if he wants that,
Yeah.
right? And then when you do it, he said, kenapa lain you nampak muka you ni? But I thought you like it.
Yeah, it's true. Yeah.
Yeah.
Why fix something that's not broken?
Yes.
Betul tak?
Exactly.
Mm.
So why are you doing this analytical thinking and a very critical thinking to yourself, and sometimes overthinking? Overthinking leads to a lot of problems in any aspects of life, not just your health, not just your work. When you overthink, you are actually orchestrating or manifesting something that has not happened yet,
Betul.
but you think it has already happened.
It happens in your mind already.
In your mind.
Yeah.
In your mind. So you
Yeah.
think, so this supports this metaphor that whatever your mind can conceive, you can achieve.
Betul. I love that saying. I love that saying.
Yeah.
Yeah.
So you better be careful with what you nurture your mind with, because it's going to manifest. Yeah. So from day one until now, I do a lot of manifesting, but I'm very careful with what I manifest. It's something that is beneficial for me, I would manifest that. But if it's something that people say to me, I will not be that reactive, but I will just be in silent and think about it, whether it's true. Because whatever people say to you or about you, it's not necessarily true. It's just their opinion.
So bila kita nak manifest pun, we have to know where the manifestation comes from.
Yes.
Whether it's from external,
Yeah.
you nak people pleasing like you said, or you think internal memang is authentic and from the purest part of your heart
Exactly.
that you might want to manifest.
Betul.
Yeah.
But also taking your points earlier on about the lunchtime IV drip trend dekat Dubai. And also Dr Sharifah also mentioned very rightly, you know what your body needs, and you pun baru recover kan, you had some illness and you had to be put on drips. So from medical perspective, actually because I treat cancer and some of my patients unfortunately unable to eat, or they have profound diarrhea because of the side effects of the treatment, or maybe part of the illness. So we have to nurse them throughout this time. Memang kita ada bagi drip, and sometimes we give some injection that contains amino acids and some good minerals. So we know the patient needs that. So we give treatment, mesti ada indikasi. Tapi sekarang ni bila indikasi itu adalah untuk cantik.
Betul.
So sekarang ni topik kita tu sebab cantik tu subjektif. Jadi how do you define the cantik, and to what extent you nak capai, and to what length you nak justify cara tu, niat menghalalkan cara or something like that. You know, because if your body don't need it, but you nak tengok orang ni bibir mungkil, you nak pakai. You pun nak pakai sesuatu supaya, you know, ataupun you pun nak masukkan drip at lunchtime, actually your body nutrition dah okay.
That's why I wanted to ask you, Dr Fariza, as a doctor, like macam IV drip ni medically, like is it healthy? Is it okay for your body to like do it
Okay, so
twice a week,
Day
3
though, I
times
think
a
so,
week?
right?
Is it okay to do it every day? Like medically, is it okay for your body?
So I think I'm going to step outside of my role here, sebab sebenarnya I treat cancer, but usually the drip, when people say drip, there's a lot of drip. So yang macam Dr Shawati cakap earlier on is actually maybe air garam kan, normal saline. It just to replenish balik the normal constituents of the electrolytes. Very good word. I put that, the word escape my mind. So
Kalau 100 plus pun ada electrolyte.
and macam budak-budak TV Padang kan, nak main bola. So
Main
dia
kelapa pun ada electrolyte.
Yes. So actually it's down to our habits. Kita yang tak jaga diri. Kita duk kerja, kita tak minum. Kita skip breakfast. Kita skip lunch sebab kita nak kurus.
Breakfast very important.
So lepas tu kita top up balik dengan suplemen sebab kita ni busy lifestyle.
Betul.
So ada orang makan suplemen, ada orang take it a bit more extreme, IV drip, vitamin masa lunchtime. But actually you ask yourself, sebenarnya itu semua shortcut. So which bring me to my next question. Sebab social media, you dah ada pressure from what you see also, tertekan nak jadi cantik.
Yeah.
Then, but from the image consultant yourself, you also portray the image by way of the fabrics, the colours, the textures, and how it looks like in the background semua kan. So jadi macam mana wanita nak cantik ni, tapi at the same time kena ambil kira semua faktor ni nak cantik. Banyaknya faktor fabric, faktor colour, faktor texture, lepas tu faktor social media, faktor nak ikut trend. Tapi bagi I from hospital, I nak tengok BMI you berapa. Kan kita ada cakap dengan Dr Malati juga, ukur lilit pinggang as a definition of obesity, which is 90 centimeters.
That's the thing. Hari tu bila I buat BMI, I was happy lah. Dia kata, okay, your BMI doesn't say that you are 56. It says that you are 38 or 39. So I'm happy. But it says here that you are obese. Obese, yeah? Obese, almost you get obesity. I say, takkanlah I macam gini obesity kan? Itulah I macam geram sikit dengan BMI punya
skill tu. Sebenarnya ambil kira berat badan yang tinggi jugalah. Tapi sekarang ni dia ambil faktor ukur lilit perut pula. So sekarang ni macam mana nak menangani kita dia ada pressure sikit lah.
Pressure untuk melihat nampak cantik.
Nak cantik tu
dengan menggunakan warna.
Macam kita nak kena ikut trend, kita kena ambil ilmu sikit, kena ambil colour ni, warna tu, tekstur ni. Tapi at the same time medical kata kena macam ni, kena macam ni, kena
macam contohnya macam kalau you badan gempal sikit, jangan pakai putih. Don't
Betul.
wear horizontal stripes, things like that, right?
Okay, so we have a lot of things here.
Nak seimbangkan macam-macam
seimbang.
kan.
Okay, mula step 1, jangan panik.
Bagus tu. Ingat jangan panik.
First things first. Okay.
Dan semua situasi.
Memang banyak benda nak kena ni. Tapi first things first. Number 1, okay. You punya badan jenis apa? Kita ada badan jenis molded, skeletal and muscular.
I see.
Okay, so you have to acknowledge that one
Yeah,
first.
everybody's different shape and different size.
Shape and different size, and also the height is different. And then number 2, what's your body type, body shape? That one was body type, so this is body shape. Okay, so body shape macam mana? A triangle ke, inverted triangle ke, you know, or a pear shape, or boxy. We have a lot, you know. But the aim here is to look hourglass.
Okay.
Kan we want to aim to look hourglass because that's the
Karanga type.
most tapi the most suitable
Mary Monroe.
shape lah. Okay, that's number 2. Number 3, okay, who are you? What do you do? What is your function of work? What is your lifestyle? Kan? So you determine that first. And okay, say you're working in the hospital. But most of the time, some hospital punya ni, dia pakai hospital punya clothes kan?
Like a scrub.
But of course, before you get to the hospital, you want to look good also lah. Kan sometimes you want interview you as a doctor ke apa, you takkan nak pakai baju putih tu kan, dekat apa tu. So you need to present yourself professionally. So kalau doktor ni dalam kategori professional. So professional means you got to have a nice suit, a nice jacket, nice shirt and all that. So once you determine you are professional, then okay, number 4, you kena tengok, okay, what kind of colour that suits you? Because not every colour suits everybody. Because every colour have a different story.
Betul.
All the
The
colours,
symbolism of the colour.
every colour will suit a different message.
Okay.
Because every colour has a psychological story behind it. Okay, let's talk about the colours that you like. What's
Okay,
your
for example,
colour?
I suka biru.
Biru,
Nampak?
of course. Wearing dark
It's
blue,
a
right?
giveaway.
When my colourblind, I said dark blue.
Dark blue.
Okay.
Tapi contohnya in my clinic kan, sebab sometimes I give bad news in my clinic. Sometimes I have to counselling patient yang sedih ataupun nak give up.
Good point.
So what's the peranan colour and then baju yang I pakai masa tu semasa memberi counselling benda-benda morbid macam tu.
So you see, blue or all these cool colours always have a very calming effect.
I see.
Especially if you go to a TV station, they have a blue room. Why blue room? Because blue gives you a calming effect. Yeah, it's natural. Let's say let's say now if I were to have someone to look at Sasha and yourself, which one do they feel calmer? definitely Dr. Kalma.
But I know her, I feel comes around her lah. But ini macam first impression you.
Yeah. But sort of I'm getting the vibe, even from here, that's bold. Bold color means you want to be seen, you want to be noticed. Yeah, it's bold color, and it's also attract. Attract people to you. But now the aim in the hospital is that to be more approachable, correct? And friendlier, and how people
Jangan tak tergarang sangat kan. Jangan nak marah-marah kat patient.
tak pernah garang lah.
Tak makan ubat.
Tak garang look.
Itulah belum keluar lagi.
Okay, so what I'm suggesting is, kalau nak suruh patient lagi more approachable to you and more friendlier, you need more colours that's bright and light and very friendly, like pink. But pink also ada different tones of pink that suits you, because it also has to follow your skin tone. See, like on the surface right now, when I'm looking at you, you have a very natural pinkish
I can get analyze
elements or pigmentations, or not pigmentations, pigments, not pigmentation, pigments. So you have to play around with that. So get a color. Okay, this pink is a bit bright, a softer color. But this one I kena buat analysis color.
Ini dah consultation dah ni.
Ini free consultation. Come on, keep going. Tak apa.
But on the surface, this blue is very dark. So it gives someone the vibe that she's very serious. But blue always gives you a calming effect, and also gives you the approachable punya vibe. Tapi blue yang dark ni more military. So it gives more macam
banyak
takutlah.
Dekat hospital banyak scrubs pun biru juga. Tapi dia macam dekat OT dia punya biru macam biru cair. Tapi now the trend now surgeons pakai biru gelap. Nampak smart lah.
Tapi Dr. Shawati, if I just to pick on that
Biru
point that you said pasal baju ni, that's true. I will admit to that, because I knew Dr. Shawati was coming, Dr. Sharifah Shawati, and we have been to Cannes film festival together. We went, I had a fashion show there, and we went with a designer, and I know that she's very stylish. She's very like, she looks good outside. So I was like, exactly. So that's why I wore this, because I was like, I want her to like notice me too, Try my best here also. Yeah, I know you're the sweetest. But my question is that I maybe dressed like this. I have my makeup, I did my hair nicely, whatever. But I'm actually a super, super scruffy person. And my mom's always telling me off, and she's like, because I go out sometimes without even like even a bit of makeup even, and she goes like, you sebab kita kan dikenali di halayak orang ramai kan. So it's like, at least put on some face powder or something, because people are going to see you, and but that's not me. I like to just go out in my whatever sweatpants, and padahal nak pergi isi minyak je pun sebenarnya kan. So macam mana nak handle? Is it okay for me to feel like that? Is it okay?
You dah memang cantik. Even if she wear jeans, white t-shirt pun dah.
Thank you.
Orang akan tengok, because you have a different look. You have a very international look. But we're talking about someone that's feeling very down because she looks normal, but she wants to look very noticeable. So that maybe we can take. Tapi you memang warna ni.
I think because my mom's coming from the point that I'm known. You also are known in the public eye as well. So does it mean that we have to look our best all the time? It's like, like my mom said, at least put on some, bedak muka ke or something, lipstick kan. I was like, I
do agree with your mom though.
So you think that we have to, there's a certain standard to keep?
Yes. The standard that you put on yourself, that you will never fall below that.
What's the importance of having standard? What's the importance of having that internal standard?
That internal standard, to make sure that you are consistent.
Yes.
I always say this to my participant. The big C, don't ever forget that. 2 C's, consistency and congruency. First, you need to be consistent in whatever you do, whether you are dressing up or your ethics in your work or the way you handle people. You have to be consistent. It's like it's not like today you wear, tomorrow you don't, and then the next day you forget totally. but you have to be consistent. Decide what is it that you want to be and be consistent. So because that creates a brand. Other than that, you'll be like unnoticeable because you don't have that wow factor.
And that consistency also for the people around you, they can sort of count on you to
Yes.
show up.
Yes. Consistency, when you develop that, what is the benefit of being consistent? People trust you more. People feel that you are more reliable, and they feel that you have achieved a certain level of success, that they can trust you. Yeah, and then they would like to associate themselves dengan you. Maknanya kalau nak buat business, I think I nak buat business dengan dia. Ataupun I nak buat podcast dengan dia, kan? Ataupun I nak buat something that or maybe I want to have a relationship with her. You know, that kind of
Get to know her better.
Get to know her better. Because people, when they do their assumption, it's like they look at you from
analyze.
And you know that people have like 30 seconds je for the first impression tu.
Yes.
Kan?
30 seconds, sometimes faster. And you don't know what is going on in their mind. For all you know, you don't see them again. Because why? Because how you projected yourself on that day, not on other days, but on that day that they see you,
I see.
is that what they will remember of.
You leave a lasting impact or imprint on people's mind. Oh, I remember I saw Dr Shawati hari tu kat Melawati Mall. Nak pergi village grocery je, tapi pakai cantik sangat.
Really?
Yeah, I saw you kat village grocery. I saw you.
Tapi how do we face like I do get this sometimes. People will be like, "Oh, you look different than how you look on TV," or "You look different." So I sort of like,
What you mean in real
is
life?
that a compliment or is that how do I answer that? Like,
Sometimes we have to take it like this, because people always, when they see us on TV, that's how they want to remember us. And that's how they expect us to be when they meet us.
Betul.
So I get like some of my other TV newscasters last time when you were in TV3 kan. So they come to work, sometimes they all tak letak makeup. But they only make up when they want to go on air. And then sometimes we have like visits, from people outside to visit the newsroom and all that. And then I hear them say, lain you kat luar. And I noticed that, I was observing that she wasn't wearing her makeup. And that's what it means, because they want you to look like you were on air.
So we have to conform to what the image they have.
That's the price of you being on the public eye.
I guess
Because you're a public figure.
Yeah.
But I'm not just saying about public figure. The minute you step out of your house, is you have to tell yourself that I am going out to face the world. I'm not just going out to face my neighbor.
So let's show up properly.
Show up. Dress up and show up. Right?
Yes.
Because you have to put that respect for yourself.
Yes, that's a very good concept.
Tapi saya pemalas. I think you know why? Because you know why? Because I'm like
But you know what? You punya pemalas tu, you just minimum effort je, Syah. Minimum effort je. Sikit je.
Nanti belanja minum.
Ada seorang
I
kena
think
macam
because
whole work.
I've been in the public eye since elite since 17 after I did my A levels, and then when I was younger I did TV commercials. So I think from a young age, I've been in front of the camera and makeup, hair. So it's like when I don't have to, it's like such a relief, And then when somebody says, "Oh, but you have to," like my mom said, I was like, I'll be like, "So what?" I feel a bit rebellious, like. So I think I'm coming from that angle.
Sometimes bila kita rebellious ni, it's because we know it's true, but we don't want to do it. Correct not?
So my mom is right lah.
True,
Basically what you're saying.
Yeah. So that's why I said the benchmark level kita put to ourselves. Like I tell myself, I will never go out of my house without even powder, just a little bit of lipstick, and just of course my eyelashes are always intact. When I wake up in the morning, I look at myself. Oh, my eyelashes is there. Okay, siap dah. So okay, but I will not go out of the house not having all this, and then I'll make sure everything is done nicely. Then I face the world, because kita perlu memikirkan bahawa kita kena bersedia untuk sebarang kemungkinan. Kemungkinan apa?
Ya, orang nak
Mungkin jumpa
gambar.
dengan
Yes.
Prime Minister ke?
Betul.
Jodoh ke?
Betul.
Oh, yelah. Betul. So you have to present yourself in a way that you want people to look at you, that
At
you
your
want to
best.
feel that way. You know, macam, okay, let's say you kata cari jodoh kan, cari jodoh. Okay, you nak orang yang macam mana? Cari jodoh.
Yes.
Okay, I ask you back. Tapi dah ada jodoh. Okay, let's say.
Somebody presentable lah. Somebody presentable.
Okay, you say, okay, like you say, I nak jumpa seorang lelaki yang kaya, yang berkaliber, yang caring, dan segak pakaian dia, okay? Tapi bila you keluar, you
Betul
pakai
juga,
yang bedak boleh tak pakai, you expect macam mana?
Itulah
Nak
manifestation
pilih
tu.
you. Macam
Betul
tu.
juga.
So you attract what you...
So I'm curious. So
Attract what you want.
Dr Shawati sendiri, have you always since young been like proper and you like fashion and or did you have a role model? Maybe your mom was
My
like
role model was my dad. My late dad.
wow.
Yeah, my late dad. Dia memang immaculate. Immaculate walaupun dia pergi kedai dekat pun.
Dapper.
Nice.
Nice.
Sebelum dia keluar daripada kereta, dia ambil sikat dia. Baru dia keluar.
Old school.
Even now, sometimes he comes in my dream wearing a suit and very nicely dressed.
Nice.
And I'm like, oh, I miss him. You know, but
Gentleman ethics yang dah mungkin ramai lelaki tak ada.
Yeah, and dia selalu macam well dressed. Dia punya cara dia matching semua baju dia semua. And I remember last time when I used to fly a lot in kan masa zaman-zaman stewardess tu, balik je I beli baju linen untuk dia because I want him to wear that, you know. So he always likes whatever that I bought for him sebab memang dia sama taste. Sama taste. So but never back to the kita punya topik.
So I think from what I can extract some ilmu lah from Dr Shawati hari ni is actually when Sasha mentioned about the cantik part kan. But there is another layer to it which you mentioned very rightly is self-respect.
Self-respect. It's not about you dressing up for people. You dressing up for yourself, but it's also part of your self-respect. It's how much,
you know?
it's how much you respect yourself. How much you respect yourself, and how much you want something that you want, and you work on yourself.
And then that's what people see outside. People see, she looks beautiful, but the effort to look that beautiful, it doesn't come from just simply I want to nampak cantik today. It's actually come from I respect myself. I will show up today. I will conquer the world today. And whatever happens today, I'm ready and I'm gonna decide, what shoes to wear with it. Macam tu. You know, so it's not superficial sebenarnya. I mean that's why kita decide on this topic kan, because actually kita orang dah brainstorm a few topics a few months ago, and we want to because I'm quite a hardcore medical doctor because I treat cancers and chemotherapy and transplant and all that. But suddenly want to talk about something yang non-medical. It's not necessarily just about health, tapi it's about human psychology tau. It's about human psychology. I have a patient many years ago when I was working abroad. Dia kena leukemia. She's 50 years old. And then she was ni lah suka berfashion, suka cantik. Bila dia masuk kena chemo tu, dia monyok sikit lah. Tapi when she start to feel better, the eyeshadow comes out. The eyebrow comes out. So she start painting her face balik. Dia start makeup. Pagi tu kita buat orang pukul 8. Aunty dah duduk sit up. Dia still pakai rambut dah gugur kan. So she still wear the penutup kepala. But and then the next day dia kena infection. So dia dah monyok sikit. So the eyeshadow, the eyebrow tak ada. So then we say that when she's when they're healthy, the show comes out. So I think it's not just that you dekat hospital, you nak impress siapa pun, but she show up for herself. So that's one thing that I want to share today. My patient pun kalau dia dah start to feel better, dia orang macam acik-acik kan, dia rasa kat tudung cantik sikit, kalau tidak dia selempang je atau pakai nak tudung je. So if you start to feel better,
actually doktor betul, because to start with, to make you feel better, macam I was not well a few days back. So of course I did not put makeup at home, tapi I still wake up and do my hair. Walaupun I tidur dengan my hair yang cantik.
Mm.
I'm sorry but it's a bit
So nanti bila you mimpi,
yeah. Tapi bila the minute I could get up,
Yeah.
terus I
Yeah.
pakai bedak, because
Yeah.
it is very psychological.
Mm.
It's what you tell yourself that I'm going to get better. I'm going to get better. I'm going to be myself. And very cepat, I got very cepat because I had that willpower.
something to look forward to maybe.
Yeah.
When you wake up in the morning bila tak sihat tu, something to look forward to. Besok tak sihat,
Yeah.
I wanna look
Yeah.
my best.
Yeah.
Yeah.
Betul tak? It's an internal motivation. So it all goes back to internal.
Betul.
You have to make yourself within. You have to develop that within you first. Then only you can luahkan kat luar. Kat luar ni senang je. I mean, I can just tell you what you need to wear and all that.
Yeah.
All this body
Yeah.
shape, all that. But if your inside is not, able to receive that information,
That's a good word.
Betul.
not able to digest what you need, or not even ready to change yourself to the betterment of yourself, it
Betul.
will not work.
Betul.
So it's a relationship with you and you.
You and
Yes.
You and you.
Yes.
You
You talking to yourself
mirror.
in the mirror.
Yeah. Look at
Yeah.
Man in the mirror, lagu Michael Jackson tu kan.
that you need to concentrate on.
Yeah.
Yeah.
So I always believe that lah.
Yeah.
Yeah.
I think for me, I also have to highlight that it takes a village sometimes to make me look good. I have to admit, because you have the makeup artist, and the makeup artist it's an art. It's an art form. When they do my makeup and do your hair and transform you, the designers, the stylists, they all come together to make you look good. And
It's artwork.
yeah, I just want to say thank you to all of you for helping me look good. Internally, I think I feel good, but also externally, sometimes you do need the help of other people to dress you up and do your makeup and all that.
Yeah.
kind of
Nowadays
thing.
banyak tutorial
Yeah.
on TikTok, IG.
Yeah.
Yeah. So sebenarnya instead of kita rasa pressure sebab social media, kita gunakan balik social media tu.
Yeah.
Tu dapatkan ilmu.
No
Yeah.
such thing as ugly. There's no ugly person here in this world. Everybody created by God uniquely in their own rights, but it's up to you to understand what is the most important strength that you have.
Betul.
Macam kadang-kadang kan ada setengah orang cakap, cantik lah you. Tak ada lah. Why you meninggal
Terima je.
Yeah.
kan ni?
Terima lah.
Yeah,
Terima je.
compliment.
Alhamdulillah, thank you. And then go back and say, cantik ke?
Yeah.
Okay, what should I do?
Yeah.
Dia tu
Yeah.
perasan pula kan.
Yeah, it's okay, perasan.
Yeah.
I mean, you need to be full of yourself.
Yeah. I feel that when people ask me my age, and then I just said next year I'll be 50, and I find a lot of people they don't want to embrace the age, but that's up to them whether they want to. But for me, I feel I don't mind giving away my age, and I feel like I've come this far. Alhamdulillah, I'm thankful for that.
That's good.
And then whatever I've been given, health wise, and
Bersyukur.
how I look now.
Yeah.
So, but I don't know. Some people they maybe they're shy to disclose their age, and
They are shy. Maybe it's from the background that they came from. It's like their upbringing. Because sometimes people are not used to this, and then tiba-tiba they see on the social media, they want to be the same like these people. But they never analyze who they are, and are they at that stage where they need that? Do I need that? These people are all working what? You kerja apa? You don't have to be like them. Just be yourself. Be the
Yeah.
best version of yourself.
correct.
Say if you're a teacher, takkanlah you want to look like Gigi Hadid pula, kan?
Yeah.
I'm saying it doesn't make
Yes.
sense.
Yeah.
So be realistic. Whatever that's shown on social media, it's not all true. It's just the surface je that you see.
Betul.
Dia orang balik pun makan Maggi juga.
Sedap tu lagi tu.
Yeah. So you don't know their life and all that. So don't be affected by whatever that you see on the social
Yeah,
media.
everybody's on their own journey, own lessons, learning their own lessons, kan?
Yeah, embrace your own journey. What you have now, you think what you have now is something that you wish for a few years back. But you have it
Dah
now.
dapat dah.
Why can't you be grateful?
Mm.
Why you comparing yourself with these people yang billionaire ni semua ni?
Mm.
Do you need that?
Yeah,
Ask
exactly.
yourself, are you really happy now?
I agree 100%.
Yeah.
I think I spoke to you just now about when we went to Cairns, I think it was what, 10 years ago, maybe a bit less, 8
Was a
years,
really
but quite a
wonderful
while ago.
trip.
And I was saying, because I did look at some pictures when we took there. I was like, oh, I was so skinny back then. But
No, you
but it's
weren't.
okay. I think I have put on weight now compared to as before, but that's okay because it's a journey that I'm on, and it's
Yeah.
natural how the body changes.
Yeah.
I can't stay forever the same shape,
Mm.
same size, weight, whatever it is.
Mm.
So I embrace it, but I have to still keep up with going to the gym, try and go to the
Yeah.
gym, and then the point is to
Yeah,
stay healthy.
maintenance. Yeah, maintenance.
Yeah.
I mean that's very important, Doctor. Kan. I mean, besides taking care of ourselves from within, we also need to take care of ourselves physicality, spirituality.
Mm.
So it's about mind, body, and soul. Kalau you take care of your mind, dia tak take care of body, susah juga.
Betul.
When you take care of your body, you never take care of your mind, pun it doesn't work because your mind controls everything.
Ada tak your clients yang people that you work with or people that you train, they take shortcuts because of they are not able to identify the self-respect.
Yeah.
They don't have that self-relationship lagi, tapi they nak catch up looking good as you, as trendy as you.
Yeah.
So they take shortcuts. What are your comments about these women?
Means
Shortcuts macam for example,
Maybe diet plans like
crash course,
diet plan,
skip
surgery.
surgery atau I mean no judgment on whoever's
Yeah.
doing surgery or any aesthetic procedure, but as we said earlier, di belakang cantik tu there's another layer of self-respect, and a lot of people is actually lompong kat situ. They don't even know what's the self-concept, self-respect, tapi dia still nak show up, beautiful, so they take shortcuts. For example macam vitamin drips tadi, maybe at lunchtime instead of identifying your healthy diet, drinking 2 to 3 liters a day,
Correct.
you shortcuts kat situ.
Yeah.
So what
I guess it's like different priorities.
so how do you
It's a matter of choice. Whenever I train or when I do my training or sometimes personal consultation, I always study my client dulu. I tengok dia siapa.
on individual basis?
Individual basis.
Yes.
Tapi kalau kita buat training yang macam dengan crowd, I also scan my crowd. So sometimes I cannot approach one person like one size fits all.
Yes.
Because they go through different things in their lives. Kan?
Very good. You take a individualized, personalized approach.
Yes.
That's
Because
very
it's,
good.
I'm more on NLP kind of approach, neuro-linguistic programming. So I'm a master
Okay.
practitioner. So I inject that into my training. So that is more on understanding who they are. So I scan the participant. Kadang-kadang you tak boleh cakap, okay, you kena pakai ni. Because different people. But I tell them, okay, not to be too concerned about wanting to be in trend. Be concerned of wanting to be healthy and you look like you. You don't want to look like somebody else. Okay? So that's where the stress comes. Because you want to look like her. But you're not her. In terms of personality, in terms of size, in terms of height, you're not even that person. But why do you want to look like them?
Betul.
But maybe because they aspire to be this person, because this person have a different personality or different some characteristic that they want to emulate. Idola. Tapi I always tell them, be the best version of yourself. If you try to be somebody else, this is where you get stressed up for nothing. You are preparing yourself for this. You yang create the stress, not anybody else. So please try, if you want to be fashionable, let's work on how you can be fashionable. With your physicality ni kita discuss.
Okay, Fariza, sebenarnya kalau ikut skrip ni, saya baru tanya satu soalan. Tapi dah lama juga kita borak kan. Tapi tak apa. It's so interesting, so much information.
Betul.
Thank you so much. So, I'm going to continue with the next question. Okay, jadi bagaimana pula dengan tekanan, I like this question. Bagaimana pula dengan tekanan dari masyarakat untuk kita berpakaian dan menampilkan imej yang sesuai dengan umur kita or dress your age. So, di umur kita sekarang, mature ladies, tidak semua bertuah untuk mempunyai bentuk badan yang the ideal body
Hourglass.
image. Ya, sebab yelah, selari dengan usia kita,
Satu hormon.
different
Metabolism.
body changes,
Yeah.
different rates for different women kan. Jadi perubahan pada bentuk badan dan gaya hidup memang berlainan.
Betul.
Yours different, mine will be different, and
Yeah.
Dr Shawati will be different. So dalam this whole journey that we're going through with our body changing, ada yang bergelut dengan cuba mencapai image kekal muda. So what do you feel about that? Yang
Yeah.
people still want to look in their 20s, even though they may be in their 40s or 50s,
Masih
and
berpakaian.
they still dress like, you know, when they were early 30s or late 20s maybe.
Yeah.
They will say, oh, you know, why is she dressed like that? And you should really dress your age.
Who
What do you
said?
think about that?
The people said to her lah. Ke macam mana?
I mean, in general, like I have come across people. I think in elite also we face that sometimes. We dress because like in elite we all have different styles. We all have different styles and different personalities, so we like to wear different kind of
Clothes.
images and clothes and all that. And then sometimes they will say, you know, padahal dah mak, dah anak dah ramai semua, dress pakailah macam seorang ibu yang, you know what I mean? So macam mana
But
tu?
you're elite.
Tapi kan yang diorang cakap-cakap ni, sebenarnya diorang nak pakai macam tu. Tapi tak boleh. Jadi dia kritik orang lain. Jadi
Itu sebenarnya.
jadi jagalah diri sendiri tu dulu sebelum kita tegur orang lain. Tapi soalan tadi tu, okay, I based on the soalan tu, macam mana kita nak nampak muda dalam usia yang sudah meningkat. Bagi saya, kalau usia you 56 tahun pun, kalau badan you masih lagi macam 20 tahun, why not?
Kan?
Why
Betul?
not? Who say cannot? Who say cannot?
Mm-mm.
They say cannot?
Mm.
Or you want to follow them?
Mm.
Or you want to make yourself happy?
Mm.
You know, to me, I want to make myself happy.
Mm-mm.
You should make yourself happy than trying to please everyone. The recipe for failure in anything you do is trying to please everybody.
Betul?
Not everybody will like you, yeah? But
Yeah.
you must like you. So you must accept yourself the way you are. Even you're 56, if your body still looks like 20, but of course, saya ingin tekankan di sinilah ciri-ciri kesopanan tu kena ada.
Betul.
Kan?
Betul.
So of course lah, kalau macam in a situation where you have elderly people,
You want to look classy.
you want to look classy.
And
And it's,
respectful lah.
you want to be respectful. And you're not just respecting yourself, but you are respecting the environment that you are in. Sometimes kita nak pergi, kita tahu, okay, siapa ada kat situ? Bapak dia ada situ, and then anak saudara dia, and then of course you don't go there wearing short skirt, even though you have a 20-year-old body. That's not being
Respectful.
Yeah, and that's not being respectful, and of course you're not being very smart to do that,
Betul.
because you are putting yourself in a position where you are going to be critiqued by people, and that's where you don't like it, but you still do it.
Betul.
So for me, if you have a body of 20-year-old, yeah, you can use whatever clothes that you like. It doesn't mean that you're 56, you can't wear already your shorts or whatever, but it depends on the situation that you are in, the event that you go to, the place that you are, you are going to. And of course, you mesti mengekalkan ciri-ciri konvensional lah. Dan nanti kita
Ikut majlis.
ikut majlis. Tapi kalau you badan umur 59 pula, umur 56 years old, badan dah besar, okay, you don't worry about that, because beauty is skin deep, and beauty is not because not only people who are kurus. You can be beautiful in your own skin, but there are things that you can do. Choice of color, right choice of color, right choice of silhouette, right choice of cut, right choice of prints, that can diversify the focus of your figure challenges. I call it figure challenges. I don't say FAT, I don't say CHUBBI, BY or something. I say figure challenges. Everybody have their own figure challenges. I mean, I'm not perfect. I'm far from perfect. But I know my figure challenges and I don't show them to the whole world. For example, if someone has kaki yang bengkok lah, bila you diri, you tahu kaki you tu macam gitu.
Bow-legged.
Ya, bow-legged. Janganlah pakai short skirt. Betul tak?
Yeah. Know your strength.
Why you doing your kaki like that?
Wear long skirts.
Wear long skirt, wear pants, it's how you camouflage your figure challenges. So ada cara nak nampak cantik at any age. You can be fabulous at any age. Coco Chanel cakap, quote by Coco Chanel. Yeah, be fabulous at any age. And don't let people tell you don't look good or that. Don't care. You feel good about it. You feel happy. You feel energized. Do it.
Because happy people don't hurt others. So kalau you dah happy, you tak sempat pun nak
yeah,
criticize
betul.
orang lain.
Betul.
Because you're so busy enjoying the happiness inside you and respecting yourself and looking forward to esok nak pakai baju apa.
Yeah.
Esok nak
Like that.
how to do my hair tomorrow,
Yeah.
kan? Tapi kalau you kerja memang nak kritik orang lain, tapi that's your trigger point. You nak kritik orang lain. Is there something yang orang tu ada? You tak meet inside.
Yeah.
So you project it on others. So I actually have some experiences with this where I got criticized. Even at work, maybe I don't wear baju as a conventional doctor. You know, as a doctor, you expect to wear certain suits, certain things. And then sometimes I suka long dress. I suka like floral print sometimes.
Yeah.
And sometimes a bit more expressive. And it's not conventional. Jadi, when people comment and I said, but at least I not being disrespectful to my patients. I lah pakai terdedah-dedah sangat.
Yeah.
So be respectful to yourself and to others. So little things like macam bagi I, kalau ada benda you tak berapa criticize me, maybe if benda tu critical membina,
Kritikal yang membina.
Kritik membina kan saya ambil maklum. Saya ambil nasihat tu dan mungkin saya boleh improve. Tapi kalau saya rasa no, actually it's not based on anything.
Correct.
Then orang tu kena reflect balik kat diri dia, which part of me that triggered you.
Yes.
And then you kena buat internal work, and then you need to do self-love, and you need to respect yourself. So actually beauty, as you Coco Chanel said, as you said, is beauty is skin deep.
Yeah.
Deeper than that is self-respect. And where do you get self-respect from, Dr. Shawati? Where do you get it from?
For yourself.
What, kalau pendengar kita tengah dengar kan, kalau dia pun cakap, oh lah aku tak ada relationship dengan diri sendiri, aku sibuk cari ke orang definasi cantik.
Itu sibuk duk
Where
cari
do you
orang. That's why you forget yourself. Yeah. Macam doktor mention tadi kan. When you wear short sleeve and then you have to put the cardigan, you feel comfortable. That's automatic because sometimes, okay, let's say you are treating anak-anak kecil kan. If you wear a jacket, it's very commanding. It's the vibe that you're giving to the kids. Macam tak
Rigid sangat.
rigid. So you have to be like them. I mean, you have to be at them.
Ada doktor pakai tie yang gambar kartun kan, gambar Winnie the Pooh kan.
Take out the cardigan and then go to them and they feel more at ease with you. But then when you treating orang tua lah kan, orang tua ke yang pakai
Atuk-atuk
ke atuk ke,
Yeah.
then you pakai less short sleeve. Of course he will like.
Diorang pun tak selesa lah tengok kita.
So you put your cardigan. So you adjust the situation accordingly. Not like you wear this thing everywhere you go. You wear that. No, cannot. You just accordingly to the situation and the conventionality of the time that you go. You know, kadang-kadang pergi wedding orang kan, tengah-tengah hari ni kan. I tengok ramai yang kita ni dah fikir dah baju nak pakai apa kat wedding orang ni. Orang tu raja sehari.
Kan.
Biarlah dia shine.
Somebody turns up to wedding wearing white.
So
Jadi you pula.
Ini kan.
pula you sibuk-sibuk pergi buat baju sampai 2-3 ribu nak pergi attend wedding orang kan. Okay, wedding one thing. What time? Lepas tu tengah hari dekat rumah.
Okay, Ma.
And you come with princess punya baju ni. Kan? That's not being respectful to
Ya,
Hormati
betul.
majlis juga.
Betul.
kan.
Betul.
Sama juga orang buat tema majlis tema ni formal. Casual, smart casual. Not many people know what is smart casual. They think jeans and t-shirt is smart casual. That's not smart casual. That's casual.
Yeah.
You know, so apa tu, pergi wedding ni kan ada yang laki-laki pakai jeans dengan baju Melayu.
Oh, aduh.
Oh
Ada.
my god.
Style baru.
I nak pingsan kan I tengok. Seriously.
Yeah.
You don't lah do like that.
Yeah.
Baju Melayu and baju kurung is your traditional wear which you have to respect.
Yeah.
When you wear it, you have to be proud. You have to be
Yeah.
proud of your own culture.
Yeah.
Mana ada orang Indonesia pakai kebaya, pakai jaket,
Betul?
kan?
Nak show off lagi kan, lace-lace semua tu. Ha.
Yang tunjuklah kebaya you, baju kurung you, kan?
Yes.
Setengah bila I, train the government sectors, kan? I tengok dia pakai baju kurung. Lepas tu pakai jaket pula ada baju kurung. Mana
Sejuk
boleh?
kot.
You
Memang
tak-
sejuk.
memang dia sejuk. Tapi I kata sejuk, you can use pashmina shawl. Yeah.
Selendang.
So, more in keeping with the fabrics of the baju kurung.
Yeah, so the demure-ness tu
Yes.
kena dengan relativity of that concept of the baju. You pakai jaket atau baju kurung, dia macam you makan keju dengan sambal belacan. It just doesn't go.
But so many people do it.
Yeah, but it's been disrespectful towards your own culture. Kita tak ada apa dah lagi culture kita yang nak kata this Malaysia.
Yes.
Kebaya. Indonesia have kebaya.
Yes.
But what do we have? Baju pahang, baju kurung, kan?
Mm.
Wear it nicely,
With
wear it with pride. You know? Yeah.
So kalau pendengar kita kan macam nak the first step, actionable steps
Yeah.
towards beauty tapi meaningful.
Hmm.
For example, the relationship with yourself,
Yes.
respecting yourself. Tapi the end product would be the aura of beauty tu. So what are the actionable steps that you would advise? Where do they start?
Okay. They need to start with loving themselves first. Self-love.
Yeah.
What is self-love? Not many people know. They always ask the same question. What is self-love? Self-love is making yourself happy, doing the things that you like. From there, you start to think, what can I do for myself that makes me more happier, makes me more beautiful? Self-love. Go to the spa. Learn how to do makeup. Learn about the how pemakanan. Then
Kalau kita buat yoga, macam yoga,
Yoga, yes.
relaxing.
Yes, everything. It doesn't mean that self-love tu hanya buat yoga ke apa semua. Self-love is also just by walking in the park where you feel peaceful.
Hargai ciptaan Allah.
Hargai ciptaan Allah. You go to the
Yes.
sea and just enjoy the sea. And just enjoy the majestic creation by Allah. You know, that kind of thing. Gratefulness is another thing to start with.
Yes.
Bersyukur. Bersyukur. I am not lah orang warak ke apa, tapi bersyukur is something that you can start.
That's the most fundamental.
Yeah.
Most fundamental that you can start within yourself. Saya bersyukur, saya dianugerahkan wajah yang cantik, ya.
The real yang sempurna, mata boleh melihat. Ya,
Semua.
betul.
Because you tengok orang lain yang tak ada tu, you tak pernah fikir ke? How do they feel? You know, you have this. What are you going to do with yourself? Work it up. You know,
Work it, girl.
on yourself.
Yes.
Jadi, I think we've really delved into this topic. Like, you've shared so much of your
I love
your experiences and everything. So I just want to touch a little bit on penuaan dengan Anggun, aging beautifully. Adalah tentang menerima proses semula jadi. It's going to happen. You can't avoid it untuk menjadi lebih tua, but it's how we go about it. So sambil mengekalkan kesejahteraan fizikal dan mental, like Dr Shawati said, ia bukan saja tentang kelihatan muda, malah fokusnya ialah tentang buat pilihan untuk sihat, is very important,
Yes.
healthy,
Yeah.
kekal aktif dan feel good about yourself. We've talked a lot about that. Jadi ingat, penuaan adalah satu keistimewaan. Everybody gets to experience it at a different level, and it's beautiful. It doesn't mean you're growing old. It's something like you said, nobody's ugly. Betul tak? Yeah. So kita harus lihat penuaan ni sebagai peluang untuk memperolehi kebijaksanaan dan pengalaman. Betul tak?
Betul. Very, very betul. Sebab apa? bila kita tahu kan, okay, everybody will go to that stage. You know you're growing older, yeah, but is growing older giving you that certain fear? What is fear? Why do you fear growing old?
Yeah.
Because you fear that your body will change. You fear that your skin will be sagging and all those things. But there are things that you can do about it. Yeah. So growing old gracefully is by accepting yourself of who you are and what you are. So if you can do that, accepting yourself as you grow older, then you'll be okay. And don't just sit on the couch. You have to move. You have to
Ini
move.
bukan kita, bukan kita. Ini untuk
Okay, ni hari
tujuan
ni-
podcast.
Okay, don't just, I mean, that's a metaphor lah. I mean, it's just a,
Yeah.
don't just sit. Your body needs to
move your body.
Be active.
Your mind needs to move.
Yes.
Because your mind's got muscle in it. You have to move that muscle by thinking of ways to do things or making yourself better. You know, go for exercise, you know. You cannot grow old by thinking, oh, I'm growing old. No need lah to do all that. Dah tua dah. I tak suka dengar macam tu. Really, if someone says this to me in front of my face,
Yeah.
I'm just going to give it to that person.
Yeah, I'm like that too. Yeah.
Yeah.
I think I've embraced it. I think I've always been like that though. But I mean, I can. It's interesting to understand why somebody can't though. But like I said, there's always a backstory to it.
Yeah.
So different people have different stories. So we have to accept. Yeah. But
people
I think it's healthy to accept
Yeah.
your age, the journey that how far you've come along, and all
Yeah.
that.
No matter what you're going through, I'm sure a lot of people are going through a lot of things. Yeah, a lot of things. And we feel for them. Okay, the hardship, the struggle, the challenges, everybody goes through this. But I just say one thing. I just want them to remember one thing. Never lose yourself.
Oh, yeah.
Never lose yourself. Only you can make it happen.
Yes.
Nobody else.
Yeah.
It's always me, myself, and I.
Seriously, such a powerful message from Dr Sharifah.
Yeah.
Because I feel it. I
Yeah.
know what women especially are going through.
Sebab kita dah ada wisdom tu, kita dah certain age, we carry wisdom with us.
Yeah.
Never lose yourself.
Yeah.
Macam perkataan macam, dah tua, dah tak payahlah, duduk kat rumah je lah.
Oh,
no. Dah tua, dah tak payahlah pakai baju macam tu. No, why? Why?
Why you limit yourself? Yeah. Why put limitation on what you can achieve kan?
Yeah.
No, you can never say it's the end
Yeah.
until it's really the end.
Yes.
You know? And sometimes people ask me, don't you ever stop thinking, why should I?
Yeah.
Why should I stop thinking?
Yeah.
That's why orang tu punya trigger. Itu dia punya insecurity, they project it to you. So that's why I said every time people criticize us,
Tengok I kan buat.
tapi kalau ada criticism yang membina, kita ambil. Tapi kalau ada orang just macam nak komen-komen je, sometimes it's their insecurity projecting toward us.
Yeah.
So kita pun ambil iktibar jugalah.
Mm.
So such powerful and insightful sharing from you, because bicara tentang cantik ni, orang anggap benda tu superficial, tapi bagi saya
It's not
there's there's a lot of
It needs to be talked about.
internal work
Yeah.
done.
A lot of internal.
A lot of internal work, and it's your self relationship and
Yeah, you talk to yourself as well every day.
yeah.
Yeah.
And itu sebenarnya yang orang tak berapa perasan, tapi saya nak cakap sikit lah. It's a closing part also. Tapi sebenarnya kita ni ada dua parts. Kita punya roh dan kita punya minda.
Betul.
And then kita have the physical body. And then the roh part, I mean, I'm getting a bit spiritual here, but the roh part is actually, itu the relationship dengan roh kita.
Yeah.
That is the respect where it comes from.
Betul.
So, what I can conclude from talking to you also, Dr. Shawati, is actually the keseimbangan. Keseimbangan. You nak pakai fabric ke, you nak pakai jacket or materials, texture, colours, but tak diseimbangkan dengan self-respect, respect kepada situasi, kepada orang-orang yang nak menengok kita. tak seimbang tak jadi. So terima kasih kepada Dr Shawati kerana berkongsi ilmu, dan terima kasih kepada pendengar kerana mendengar celoteh kita.
Betul.
Dan juga insyaAllah kita berjumpa lagi dalam episod Hello Sihat, Apa Khabar.
Betul.
Dan teruskan usaha untuk mencari makna dan erti.
Yeah. So please tune in untuk episod yang seterusnya. Kita akan bincangkan topik-topik yang lain yang dari hati ke hati bersama anda. So please be kind to yourself and others, and do take care of everyone around you, and most importantly yourself. Sampai kita jumpa lagi.
Alright.
Okay.
Hmm.